Welcome back to MPN's Family Peer Support Provider Training Series, video 2 of 4.
So in 2007, the Center for Medicaid Medicare Services approved the use of Medicaid funds for peer support services. And in 2007, we had the first paid peer support specialist. This was through waivers and through grants. And again, we're talking about in the state of Montana. In 2008, there were 6 peer-run drop-in centers that opened up. They were funded through the state of Montana, and that's where I got my start in 2008 in Livingston, Montana, and I got to start a drop-in center program. From 2007 to 2011, individuals in recovery began to organize, and there were lots of efforts around this. It looked like many different things, but it began to organize. This was already happening nationally in some states, and so it was just very naturally coming to Montana, and we're beginning to think about what could this look like now that we had some peer supporters, we had some drop-in centers. And so that led to 2011, the founding of Montana's Peer Network. In 2012 was the formation of the Peer Support Task Force to create the profession of behavioral health peer support. And that was a partnership between the Department of Health and Human Services and Montana's Peer Network. In 2015, the utilization of peer support standards and training went into effect. So what we mean by that is in 2015, Montana's Peer Network started training all current and potential future peer supporters. That training was developed by the Peer Support Task Force, the core competencies, the exam. It included scope of practice, code of ethics, and began to pave the way for what we were really after, which was the recognition of the profession of behavioral health peer support specialist, and that would come in 2017. And it was Senate Bill 62 passed, and it created the profession. And on October 1, certification of behavioral health peer support specialist began. It wouldn't be for another almost a full year when we saw the first officially certified peer support specialist by the Board of Behavioral Health through the Department of Labor. And then in 2019, peer support became a Medicaid billable service. That was another bill that went through the legislature, and it allocated just over $6 million for peer support, so it would become Medicaid eligible. In 2020, we had 130 certified peer support specialists. And in 2021, there were 13 drop-in centers funded with federal block grant dollars. And you'll notice we talk a lot about drop-in centers because these are key for communities and recovery and wellness programs. These are free programs that people can come to. They don't have to be diagnosed. The program is paid for with a grant. And inside the program, you'll find peer supporters, people with lived experience in recovery. They can work one-on-one, they can provide support groups, resources, mentoring, coaching, that kind of thing. In 2021, we also saw another bill pass that we were part of, which was granting a certified behavioral health peer support specialist a seat on the Board of Behavioral Health. This was another big milestone. The Board of Behavioral Health oversees licensing for other behavioral health professions, such as LCPCs and licensed addiction counselors, social workers. And then in 2021, we also saw Governor Gianforte include peer support in the HEART initiative. In 2022, we passed the 200 mark. So meaning we had 200 certified behavioral health peer support specialists in Montana. The national certification for family peer support was established by the National Federation of Families in 2012. As of 2020, there were 25 states that had certifications specific to family peer support. These states include Colorado, North Dakota, Idaho, Utah, Oregon, and Washington. One thing you will notice is those are all neighbors to our state of Montana. Yet we are one state that does not have certification for family peer support. Our certification is only for behavioral health peer support.
All right, I'll be going over part 3, defining family peer support and wellness. I'll tell you first a little bit about my own story. About 10, 15 years ago, our child had their first hospitalization in the psychiatric hospitalization center at the age of 13. That really threw my husband and I into a world that we didn't know. We didn't know behavioral health. We didn't know psychiatric centers. We didn't know any of that. We had never experienced that before. And so we really felt like we were just walking blindly along this path. And that's really what prompted me to become a family peer supporter. We could have used somebody that had experienced that before. We could have used somebody that could help us along navigating systems. And so it was just a really hard 3 or 4 years for our family. Our children are doing really well. And this, like I said, it prompted me to become a family peer supporter. All right, defining family peer support. So it is a parent or caregiver with lived experience raising a child with a behavioral health challenge and or special health care need, who with training then provides support to another parent or caregiver who is currently raising a child with these same needs. The family peer supporter works directly with the parent or the caregiver, not the child. And the child has the behavioral health challenge and or the special health care need. So I just want to go over a few definitions. When we talk about family, we are defining that as a parent or a caregiver. Child is defined as an individual under 21. Behavioral health includes mental health and substance use disorders. And children and youth with special health care needs are children who have or are at increased risk for chronic physical, developmental, behavioral, or emotional conditions who require health and related services of a type or amount beyond that required by children in general. So family peer support includes, but is not limited to, active listening. It's a really key. It provides a safe place for that family member, for somebody to hear them without judgment. Building connection through experience. Like I said, we both have similar lived experiences, and talking to someone that just understands you right off the bat is really helpful. Offering that emotional support. We help with system navigation. We can help them connect to resources in the community. We can help them advocate and empower the family to advocate for their child, to advocate for themselves, to feel like they have a handle on it. Some characteristics of family peer support. Again, the focus is on the parent or the caregiver. Granted, through that, the child is helped, but there is usually a team helping the child. And so we're here really to help the parent. It's a critical service. Like I said, not knowing the behavioral health system, we didn't really know what choices were out there for a child, and we really didn't know how to make the best choices for them. Lived experience, again, it's one parent just walking alongside another. Family engagement, we can help the family engage more comfortably with the care team by helping them figure out what questions they want to ask, or explaining certain, uh, explaining certain parts of the system to them. Another one is acceptance. I think that's key. We offer listening and acceptance because we have been there. We know what it's like. We strategically self-disclose our own story. So we do share our story with the families, but we do it to connect with the families. But it's really all about their story and them. It is a partnership. We're in it with them. The parents are the one who identify the goals or what they want to work on or have help with or support. It suspends the bias and the blame. I think especially as a parent, we tend to blame ourselves. And so to have somebody there that can tell us it isn't our fault is really important. There's mutuality and respect. So we are on the same level with that family. We aren't a clinician. We're not higher. We're not, an expert in the field. We have just walked this journey a little bit further than them. We get training. Like I said, I trained in Oregon, and collaborative problem solving. So really helping the families sit down and figure out what works for them, what they have support for in their family, what their weaknesses or their strengths are, and really helping them kind of problem solve. So there's 4 different types of support that we provide. The first is emotional. So emotional support provides connection from people who have quote unquote been there. Informational support would include providing connection to resources, making referrals, giving them information about the child care system. Educational supports would focus on helping them understand their child's needs, possibly increasing their knowledge and skills, and really helping them in finding those supports in their community, the natural supports too. And then concrete support it could include things such as helping arrange childcare, transportation, finding support groups, or assisting them in developing care plans.
Okay, recovery is defined by SAMHSA as a process of change through which individuals improve their health and wellness, live a self-directed life, and strive to reach their full potential. You can think of recovery as this journey that's leading you to a life of wellness. And when we talk about wellness, because I think this is a word that we use a lot in healthcare, but rarely do we really break it down. And so you see here in front of you both the medicine wheel and the 8 dimensions of wellness. Peer supporters, whether they're a family peer supporter or a behavioral health peer supporter, are going to utilize these holistic approaches to overall wellness and recovery. And they're interchangeable, and it's really about what the peer supporter has experienced in their own life, what they've been trained in, and then the individual that they're working with. So even if I am providing peer support to someone who relates to the medicine wheel, then that's great, because the medicine wheel and the 8 dimensions of wellness are really similar. They're really two types of approaches. They aren't that different. They're 2 types of approaches to overall wellness. And when you think about integrating peer supporters, you really have to think about this in terms of your practice and this holistic approach, because that's what the peer supporter is going to bring.
So comprehensive care is a is a big term especially in pediatric primary care, and especially when it comes to children, youth with special health care needs. And you can see why all of these things play a role in the special need family's life. And yet, if you look at the items that are in red, those are the things that that the primary care pediatrician normally takes care of, which is, as you can look and see, it's less than a fourth of the total life experience of a family who has a child with special needs. So in order to provide real primary or comprehensive care, we need to have someone involved in the process, someone on the team who is helping parents connect to all the other things. Not that a peer supporter is going to be the person who provides all of these things, but the peer supporter is the person who knows where to go to get started in connecting to the things that any particular family needs, a particular family sees as important, and working toward. The office, for example, doesn't have the bandwidth, the capacity to do these things. Providing these things or a connection to these things and resources and other people, it reduces the stress on the family, creates a better experience, and in the long term, it reduces the the fatigue, the caregiver fatigue that we all experience when we're raising these kids.
Thank you for watching video 2 of 4 of MPN's Family Peer Support Provider Training. Join us again for video 3.